Medical terms for eyes and ears. Our main word roots are ophthalmo and oculo for eyes and oto for ears. We're going to start off with this diagram which shows you the different structures of the eyeball. And not only that, it also gives you the combining form for every single structure. So here we are zooming in to the three layers of the eyeball. From outermost to innermost, we have the sclera, and the combining form is sclero. Choroid, the combining form is choroidal. And retina, which is the combining form of retino. So to just give you a few examples, we're going to start with very easy suffixes. Itis, inflammation. So scleritis is inflammation of the sclera of the eye. And if it's choroidal, let's say choroidoplasty, that would be repair of the choroid. And then let's give another easy suffix for retinal. How about pathy? Retinopathy. Pathy means disease of, so retinopathy is disease of the retina. We're back to this picture, and now you could see the different parts on the right side of this image. Let's focus on the iris, which is irido, cornea, corneo or kerato, and then the eyelid, which is blepharo. So let's do some medical terms here. If you remember, the suffix plegia means paralysis. So if you see a word iridoplegia, then that would be paralysis of the eyelids. And then we have cornea. Let's make it easy. We just add the suffix al, which means pertaining to. So corneal is pertaining to the cornea. We can also do kerato for cornea. Keratoplasty is repair of the cornea. And then we have blepharo, which is the eyelid. Blepharoplasty is repair of the eyelid. So this image shows you an example of a blepharoplasty procedure done. We can repair the eyelids for many reasons. Maybe there is injury, trauma, or maybe the eyelids are deformed, or for cosmetic reasons. Now we're back here and we're looking at more structures and combining forms: pupil, lens, and conjunctiva. So let's add some suffixes and form medical terms. So for pupil, we could do pupillary. Ary is a suffix that means pertaining to. We can also do pupillodilation. Dilation means opening or widening of the pupil. The combining form for lens is phaco. Phaco is the crystal clear structure found behind or posterior to the iris. So let's do phacomalacia. If you remember, the suffix malacia means softening. So phacomalacia is softening of the lens. Our last combining form on this image is conjunctivo for conjunctiva. And let's make that easy. We add the suffix itis for inflammation. So conjunctivitis, inflammation of the conjunctiva. Now I said earlier that the lens is crystal clear. You could see through the pupil through the lens. But sometimes the lens is not clear. Like in this case, this dog has this white cloudiness in the lens, and that's not just for animals, certainly for people. That is what we call as a cataract. So a cataract is this cloudiness of the crystalline lens. Light is not able to pass through, so you cannot see because that milkiness is blocking it. Cataract can be unilateral, just one eye, or bilateral, meaning both eyes have the cataract. Okay, let's add more to our list of medical terms. Lacrimal gland or lacrimal apparatus is our tear gland, and the combining form for that would be dacryo or lacrimal. So when you see the word lacrimorea, if you remember, rea means discharge or flow, so that would be a discharge or flow of tears. We had our first slide, we said eye is ophthalmo and oculo. You will also see opto and optico, but that's not necessarily eye. Those are the combining forms for vision. We have a couple of examples here. Ophthalmologist, that's your eye doctor, specialist of the eye. Optometrist is also a specialist of the eye. And then you have your optometrist, which is the specialist for vision. They measure vision. In fact, the metris or metro in that medical term pertains to measurement. So they prescribe corrective lenses, while the ophthalmologist will diagnose, treat disease, and perform surgeries. We have a new combining form here, presbyo. That is a word root or combining form that pertains to old age. Now, if you add the suffix opia, which means vision, or a suffix pertaining to vision, then presbyopia is difficulty of vision or vision problems as a result of aging. We are all going to age, and unfortunately that is one of the things that sometimes is inevitable. Okay? Here's another suffix, kusis. Kusis is hearing. So we're not there yet, but if you do presbycusis, then that is also difficulty of hearing or hearing problems because of aging. Next, we have a combining form here, glauco, which means gray. We'll look at that in a minute. Just make a mental note of that. And the last one we have on this slide is photophobia. Photo is light and phobia is fear of. People with photophobia are not really scared of light, but they are irritated when you expose them to light, which is a sign of something going on in the eye. It could be conjunctivitis. Conjunctivitis, people usually avoid the light. So that's photophobia. So remember, a few seconds ago, we said glauc is gray. So there is a condition known as glaucoma. Literally, that means gray tumor. If you remember, oma means tumor. But that has nothing to do with the disease glaucoma. Glaucoma is actually increased intraocular pressure. There's increased pressure in the eye because of excessive fluid or accumulation of fluid. And this is dangerous because if you leave the eye with high pressures, it can actually lead to blindness. Okay, let's look at a few more conditions here. Strabismus, this is when both eyes are not able to focus on the same object. As you can see in this image, you put a pencil and ask the patient to look at it, and somehow only one eye is looking at it. So there are two types of strabismus. There's esotropia and exotropia. Remember, opia pertains to the eye. So esotropia is when the eye turns inward, and exotropia when the eye turns outward. Remember, exo means out or exit. Next, we have the terms for farsightedness. That's hyperopia. Again, opia pertains to vision. And myopia is nearsightedness. I know my means muscle, but in this case, it has nothing to do with it. So myopia is nearsightedness. And now we go to the medical terms of the ear. So the combining form for ear is oto. You can see as we zoom in, there are three regions of the ear: the external ear, the middle ear, and the inner ear. So when there is inflammation of the ear, that's otitis. It could be anywhere. If it's in the external ear, otitis externa. If it's in the middle ear, otitis media. If it's in the internal ear, otitis interna. Now let's move to the tympanic membrane or the eardrum. So we have meringo or tympano. An example would be meringotomy. So again, tomy is to cut or to make an opening in this case. So we're making an opening in the eardrum, and the purpose of this is to drain the fluid. This is a common procedure we do in pediatrics. Next, we have the bones of the ear, the stapes, the incus, the malleus. The semicircular canals are where you have the receptors for balance. But right here, let's focus our eyes on the cochlea, the blue snail-like structure where you have the receptors for hearing. So let's make it easy. Let's add the suffix AR, cochlear. If you've ever heard cochlear transplant or to treat deafness or hearing loss. And then lastly, we have the eustachian tube. That's a tube that connects the inner ear with the throat, the nasopharynx to be precise. It's salpingo, which is the same as the combining form for fallopian tube. It's also salpingo. So oftentimes we don't even use the word salpingo to describe the eustachian tube. For example, in this image, we are dilating the eustachian tube. So instead of saying salpingo dilation, many people, doctors would think of that as the fallopian tube. We just say we just say eustachian tube dilation. Okay, so let's add more terms to our list. The combining forms for hearing are acousto, like acoustics, audio, like audiometry, and audito, like auditory. Okay. And then we have the mastoid process, which is the bone behind the ear. Oftentimes, when there is a very complicated, severe otitis or inflammation, it can actually go to the mastoid and can result to mastoiditis. Next, we have the medical term otopyorrhea. There are two word roots there, ot and pi, two combining forms, auto and pio. Auto means ear, pio is pus, and rhea is flow or discharge. And then we have pain in the ear. We can use two words for that, otalgia and otodynia. Algia and dynia both mean pain. And our last two terms that we don't have to break down, these are common issues for the sense of hearing. Tinnitus, this is when you are hearing ringing, buzzing, or hissing sounds, even if there's actually no external stimulus. And then we have vertigo, which is the feeling that either you or your environment is spinning, even if there's actually nothing spinning, no actual movement. So that ends our special senses, ear and eye. And once again, it's a short video, but go ahead and review it over and over. So pause it, replay it until you retain all this information. Thank you.